Cardiac function tests. Cardiac function test. It includes ECG, echocardiography, treadmill test, stress test, coronary angiogram, cardiac computed tomography, cardiac CT, chest X-ray, myocardial perfusion scintigraphy, cardiac MRI, tilt table test, blood tests. ECG, electrocardiogram. It measures electrical activity of heartbeat. Impulses in heart start and propagate in a uniform pattern. Any variation from this pattern can be abnormal or pathological. An electrocardiogram can be a useful way to find out whether high blood pressure has caused any damage to heart or blood vessels. ECG can detect a heart attack in the past, enlargement of one side of the heart, abnormal heart rate and rhythms, chest pain due to blocked or narrowed arteries in the heart, structural problems with heart's chambers, effectiveness of some ongoing heart disease treatments. It does not show asymptomatic blockages in heart arteries or predict a risk of a future heart attack. Echocardiography. Echocardiography uses sound waves to produce live images of the heart. The image is called echocardiogram. The images of echocardiogram are used to detect blood clots in the heart, fluid in the sac around the heart, problems with the aorta, heart defects, such as holes in the heart, damage to the heart muscle after heart attack, ejection fraction, the percentage of blood that's pumped out of a filled ventricle with each heartbeat, cardiac output, the volume of blood pumped by the heart in 1 minute, valve problem, improper opening and closing of heart valves, changes in heart size and heart wall thickness. Treadmill test, stress test. It will help doctor to determine the ability of heart to respond to an external stress. Patient is allowed to do exercise on treadmill. During this procedure, blood pressure, heart rate and electrocardiogram are monitored. Treadmill test is used to detect the followings. Diagnose coronary artery disease. Diagnose chest pain, shortness of breath or lightheadedness related to the heart. Determine a safe level of exercise. Check the effectiveness of treatment in patients with coronary artery disease. Prediction of heart attack. Identify abnormal heart rhythms. Tilt table test. In this test, a person's position is changed quickly and in response to that blood pressure and heart rate are examined. During the test, a patient is laid on a special table. Head is elevated to 60 to 80 degrees above the rest of the body while blood pressure and heart rate are monitored. This test is helpful to find out fainting, syncope, due to irregular heart rate or blood pressure. Cardiac magnetic resonance imaging, MRI. Cardiac MRI is a non-invasive test. It uses a powerful magnetic field, radio waves and a computer to produce detailed pictures of the structures of the heart and its surrounding area. A cardiac MRI is used to assess and diagnose the following conditions. Heart defects from birth. To determine whether heart artery blockages are the cause of chest pain. To check any damage from a heart attack. Heart failure. Heart valve defects. Inflammation of the membrane around the heart. To observe heart structure and how well blood flows through the heart and major vessels. To diagnose stroke, aneurysm and other brain abnormalities. Cardiac computed tomography, cardiac CT. Computed tomography, CT scan, uses multiple X-ray images with the aid of a computer to produce cross-sectional views of the body. It is used to visualize the heart anatomy, coronary circulation and large blood vessels. It mostly includes calcium score screening heart scan, coronary CT angiography, CTA. Calcium score screening heart scan. It is a test used to detect calcium deposits found in atherosclerotic plaque in the coronary arteries. Most effective way to detect hardening of the arteries before symptoms develop. The amount of coronary calcium can predict future heart problems. It is useful in making lifestyle changes and planning preventive care to reduce any future risk. Absence of calcium is considered a negative result. However, soft plaque atherosclerosis cannot be detected during the CT scan. Negative test indicates a low risk, but does not absolutely exclude the possibility of a future cardiac issues. Coronary CT Angiography, CTA. Coronary Computed Tomography Angiography, CTA, is a non-invasive heart imaging test. High-resolution, Three-dimensional pictures of the moving heart and large vessels are generated to determine if soft plaque, fatty or calcium deposits have built up in the coronary arteries. This technology can predict any future problems that may happen without lifestyle changes or medical treatment. Myocardial Perfusion Scintigraphy, MPS. A myocardial perfusion scan is a non-invasive nuclear medicine imaging test which uses a small amount of a radioactive tracer to investigate the blood supply to the heart. It is a functional test which can detect any difference in blood flow to the heart muscle at rest and during stress. It can also be used to assess the extent of damage to the heart after a heart attack. It looks at the blood supply to the heart muscle, from which inferences regarding coronary arteries can be made. It can show areas of the heart muscle that aren't getting enough blood flow. It can also show how well the heart muscle is pumping. Gamma rays emitting radioactive tracer, which may be technetium, thallium or others, is injected into a vein. It travels in the bloodstream and is taken up by heart muscle. Areas of heart muscle with a good blood supply will emit more gamma rays as they will uptake more amount of tracer than areas with a poor blood supply. If the blood supply at rest is normal, but the blood supply following stress is reduced, this indicates reversible myocardial ischemia, which is likely to be due to a narrowing in a coronary artery. Narrowed arteries can be traced by comparing the tracer uptake in the various different areas of the heart. If blood supply at rest is the same as blood supply following stress, it is unlikely that there is significant obstructive coronary artery disease. If blood supply at rest and stress is abnormal, this suggests that there has been previous myocardial infarction in the area of reduced blood supply. Coronary angiogram. A coronary angiogram uses X-ray imaging to check heart's blood vessels. The test is done to find out any restriction in blood flow to the heart. A type of dye that's visible by an X-ray machine is injected into the blood vessels. The X-ray machine rapidly takes a series of images, angiograms, of blood vessels. If required, doctor can open clogged heart arteries, angioplasty, during coronary angiogram. Angiogram is generally done after non-invasive heart tests have been performed, such as an electrocardiogram, an echocardiogram or a treadmill test. An angiogram can show following informations. Numbers of coronary arteries are blocked or narrowed by fatty plaques. Finding precise location of blockages in blood vessels. Show how much blood flow is blocked through blood vessels. Check the results of previous coronary bypass surgery. An abnormal result may indicate one or more blocked arteries. Doctor may choose to do an angioplasty during the angiography and possibly insert an intracoronary stent to immediately improve blood flow. Chest X-ray. It gives the following information related to heart. Chest X-rays can show changes in lungs that stem from heart problems. As for example, fluid in lungs, pulmonary edema, can be a result of congestive heart failure. Changes in the size and shape of heart, fluid around the heart, pericardial effusion, or heart valve problems. Diagnosis of aortic aneurysms or other blood vessel-related problems. Detection of the presence of calcium in heart or blood vessels. Presence of calcium may indicate damage to the heart valves, coronary arteries, heart muscle or the protective sac that surrounds the heart. To ensure the correct position of pacemaker, defibrillator or catheter in the heart. Blood tests for heart diseases. Lipid profile. It includes total cholesterol levels, HDL, LDL, VLDL, triglyceride etc. Gives information about possibility of atherosclerosis. High sensitivity C-reactive protein. Increase in blood C-reactive protein, CRP, is associated with inflammation, infection, heart attack, surgery, or trauma. Persistent low level of inflammation is associated with atherosclerosis. The high-sensitivity C-reactive protein test helps in identification of low but persistent levels of inflammation and thus helps in prediction of cardiovascular diseases. Normal blood values of high-sensitivity C-reactive protein are as below. Low risk, less than 1 mg per liter. Average risk, 1 to 3 mg per liter. High risk, above 3 mg per liter. Lipoprotein A. Lipoprotein A, LPA, is one type of lipoprotein that carries cholesterol in the blood. It consists of a LDL, low-density lipoprotein, molecule attached with apolipoprotein. Like LDL, LPA is considered a risk factor for cardiovascular diseases. The amount of LPA is determined by the inherited genes, and it remains relatively constant over a lifetime. LPA does not respond to lifestyle changes or medications. Some non-genetic conditions such as low estrogen levels, hypothyroidism, uncontrolled diabetes and chronic kidney disease may also lead to elevated LPA. Around 50% of the people who have heart attacks have a normal cholesterol level. LPA is one of the factors that are responsible of heart attack in people with normal cholesterol level. LPA can promote deposits of LDL cholesterol in blood vessel walls and the formation of plaque. LPA may promote the formation of clots in the arteries. For these reasons, the risk factor of LPA for atherosclerosis is higher than LDL cholesterol. Normal values of LPA is less than 30 mg per deciliter. Results greater than the 30 mg per deciliter may indicate increased risk of atherosclerosis, heart attack, or stroke. Natriuretic peptides. B-type natriuretic peptide, BNP, and N-terminal prohormone BNP, NT-proBNP, are released in response to changes related to heart failure and other cardiac problems. Levels goes up when heart failure develops or gets worse, and levels goes down when heart failure is stable. The results help doctor or nurse to determine if worsening fatigue or shortness of breath are due to heart failure or another problem. A normal level of BNP is less than 100 picogram per milliliter. A normal level of NT-proBNP is less than 300 picogram per milliliter. A patient may need a BNP test or an NT-proBNP test if he or she feels the symptoms of heart failure such as difficulty breathing, coughing, fatigue, swollen abdomen, legs, and/or feet, loss of appetite or nausea. Troponins T and I. Troponins are a group of proteins found in skeletal and heart muscle fibers that regulate muscular contraction. There are three types of troponin proteins: troponin C, troponin T, and troponin I. Cardiac-specific troponin T or troponin I in the blood can help to identify cardiac damage. Cardiac-specific troponins I and T can become elevated in the blood within 3 or 4 hours after a heart attack and may remain elevated for 10 to 14 days. Ranges for troponin I levels. Normal range, below 0.04 nanogram per milliliter. Probable heart attack, above 0.4 nanogram per milliliter. Normal values of high-sensitive troponin T is less than 14 nanogram per liter. A result of less than 14 nanogram per liter more than 6 hours after the symptoms rules out myocardial infarction. Lipoprotein-associated phospholipase A2. Lipoprotein-associated phospholipase A2 is an enzyme that promotes atherosclerosis. Increased concentrations were seen in many people who were diagnosed with congestive heart diseases and ischemic stroke, regardless of other risk factors. The normal range for lipoprotein-associated phospholipase A2 is less than 200 nanogram per milliliter. Higher values indicate inflammation in arteries. When both C-reactive protein and lipoprotein-associated phospholipase A2 are higher, a person may be at greater risk of having a stroke. Thanks for watching. Subscribe for more videos.